थोड़ा बहुत.
Yes. Hi everyone, welcome to my podcast Between the Lines with Bhagya, episode 2. We'll be talking about everything that I feel is not spoken about enough. So happy to have you all here, and I'm very happy to introduce Priyanka Adate. She's a very dear friend of mine, and she has a master's degree in clinical nutrition. She's 28 years young. She's a clinical dietitian and consultant nutritionist. She's a passionate dancer and also a cat mom with all the elder sister traits. I can attest to that. She helps busy professionals prevent, manage, and reverse conditions like diabetes, blood pressure, PCOS, now called PMOS, high cholesterol, higher uric acid levels, and she helps them improve their metabolic health with the power of nutrition and lifestyle. Stay till the end so you don't miss out on anything. It's going to be a super valuable conversation. So happy to have you, Priyanka.
Thanks for the introduction, Bhagya. It's a pleasure to be here.
Yes, let's get started. I have a couple of
Sure.
questions, and of course, we'll go with the flow as well. What was the turning point in your life when you decided that you wanted to become a nutritionist?
Turning point. I would say, see, I always wanted to become a cardiologist, treat
Hmm.
people who have heart ailments. But then destiny got me into the field of nutrition. So I pursued my bachelor's in food nutrition and dietetics with honors. And honestly, after my bachelor's, I was completely confused because, in nutrition also you have different fields. I could either go into the food industry, or I could become a professor, or I could get into clinical nutrition. So, with faith in my heart, I just went for clinical nutrition. I pursued my master's in clinical nutrition with super specialization in renal nutrition. So, renal nutrition, as in people who have kidney disorders.
Mhm.
While I was learning about renal nutrition, I understood that most people who have diabetes, so people who have kidney disease also have diabetes, blood pressure, and other underlying conditions. So I got to understand more in deep about these things also, like diabetes, blood pressure, and all of that. So yeah, post my masters, I did my clinical internship at a very prestigious hospital here in Bombay, KEM Hospital, and there I got to learn a lot of things. I had an hands-on experience. Whatever I learned in my bachelor's and master's, it was practically applied there, and I understood that now this is my calling. So that's how I got into this field.
That's amazing. So much knowledge, and I'm happy that you decided to take your time here to share a glimpse of that. We'll definitely do more podcasts. There's so much to discuss,
Absolutely. We'll need at
right?
least 100 podcasts to talk about nutrition because it's such a vast and dynamic field.
Absolutely, 100%. So, were there any physical issues you were struggling with, and how nutrition helped you, or how did it affect you in your personal life and help you transform?
So, see, while I was studying nutrition, I obviously was a young girl, teenage girl, early 20s. So I also had junk food and, outside the college canteens,
Mm.
all of this was happening. And of course, I was also, I mean, I am an emotional person, so I did do a lot of emotional eating without
Mm.
realizing it. Though the knowledge was there, but still, knowing something and doing something are two completely different things.
I agree. I agree.
But after my master's, when I started doing my internship at a government hospital, there we had a lot of patient load. So when you are a very ambitious person, but your body is not supporting you, you're feeling tired all the time, you're not able to achieve the goals that you wanted to achieve, it hits you. And that was the time when I was diagnosed with OCD also. So
Okay.
I had and so OCD is an anxiety disorder. It's not just about cleanliness, you guys. Let me
Yeah.
make that very, very clear. So
Yes.
OCD did bring in anxiety and depression for me as well. But when I did my blood work, I understood that my vitamin D, my vitamin B12, and my iron levels were extremely low, very
Mm.
low. So, for example, if you're like vitamin D, you're supposed to have more than 30, like that is the this thing. I had 5. I was at
That's
5.
scary. It's
That's very,
dangerously low.
yes, yes. And vitamin D has a huge role to play in a lot of things.
Mental health
B12,
also.
mental health also, exactly. So, there are studies done where all the depression patients, they have very low levels of vitamin D. So, vitamin D, yes, you are right. Mental health and vitamin D go hand in hand. B12, B12 and iron deficiency was the reason I was feeling fatigued all the time. And because I had OCD, it was already draining my body. And plus, I
Because
had
your
these
thoughts,
deficiencies
you're consumed by your thoughts, and yeah, that makes
and
sense.
the compulsions also. So the thoughts accompanied with the compulsion. So it was just draining me. And plus, there were these underlying deficiencies. So it really made my life difficult at that time. But when it got diagnosed, I worked on it. I worked on my lifestyle. And today, I can proudly say that I am in a profession where where I wanted to treat people with heart ailments. Today, I can help those people prevent heart ailments. So
Oh my
nutrition is
God.
so
That's
yeah,
beautiful.
nutrition is a preventive science. It helps to prevent any disease, manage any disease, and in some cases even reverse some
Mm.
diseases. So yeah.
That's such a beautiful perspective that you have. Instead of saying, "Oh, I couldn't become a cardiologist," your perspective is on how, okay, now I can actually help people prevent that. I think it's so beautiful. You're going to the root of the issues rather than just treating the symptoms. So that's brilliant. So what?
Absolutely.
So this is how nutrition helped you with your personal lifestyle, health issues. But why and how did you start helping people and start your own independent practice? What pain points influenced your decision?
So, because I had experienced so much myself, I understood there is no awareness about these issues. You see, every second or third Indian is deficient in B12, vitamin D, and iron, most of the times, especially women. Okay. And the problem here is that the diagnosis, lack of diagnosis. If you don't know you have a problem, how would you treat it?
Yes.
So when I myself, I saw the transformation in me. I became more productive. I started achieving and ticking all the goals that I had. I was like, I need to help more people, and that's how I started my independence. So I worked with the Municipal Corporation of Greater Mumbai for 2 years. Of course, I needed some experience there, and there I understood that there's people just don't know anything about food. There are so many myths revolving around food. People just believe in one food item to fix all their issues. Like for example, you must have heard, so for diabetes, you have karela and you'll be fine.
Mm,
That's now how it is. So one food is not going to fix your health. You need to improve and work on your overall lifestyle.
absolutely. So, when you started your independent practice and you started dealing with people, what other common myths did you see, or like, what do you think people need to know? Like, for the listeners listening to our podcast, what is the
Yeah.
message you would like to give them?
Oh, the first message I would like to give them is one meal is not going to make or break your health. Okay.
Mm,
So if you have a bowl of salad one day and then tomorrow you're having junk food, so that salad will have no meaning. Okay.
mm,
So nutrition or nourishment doesn't happen in one moment. It is a pattern. It is something that you need to keep doing every single day. So,
right.
similarly, just one dessert is not going to make you fat. If you're having one dessert, you're going to a party, you're having one dessert, and the next day you're bouncing back to your lifestyle again, to a healthy lifestyle again, that dessert, you
That
will burn out the
consistency need,
calories like this.
right, right.
Yeah.
Yeah, that's a great point. It can be seen both in a good and bad way, right? One meal cannot define, so it could be the other way
Yeah.
around as
Right,
well.
right. And people fall prey to a lot of crash diets, I get clients, and when I ask them, what have you tried earlier? Oh, we stopped having dinner completely. Oh, we stopped rice completely. That's not how it's done. You have to balance everything. And nutrition is just one aspect of it. When you look at lifestyle, nutrition, your workouts or exercise, sleep, and your stress management. These four pillars play a major role. And
Mm.
all of these things are interrelated.
Nice, nice. It's so important that we focus on everything as a
Holistic, yeah.
at a holistic level. And yeah, that's amazing. And me also, like as a somatic coach, we focus on not just dealing with the mind or body, but connecting mind, body, and breath and healing holistically and integrating all of that. So same goes with
Amazing, amazing.
nutrition.
You
So
should you should integrate nutrition also then in your
yes, now I
practice.
have you. So yeah, that I told you, you come as my guest speakers for my sessions. So yeah.
Yes,
And also, like people need to learn to listen to their bodies, right? So when they have a good relationship with themselves, they know what to give their body. Otherwise, they're so numb and they have no idea what their body's asking for them. And if they are not aware of what the body's asking, how will they give it what it needs? So I guess.
absolutely. As I told you, diagnosis is a huge problem. People procrastinate doing their routine checkup. And then
How
you
often
know,
do you think people should do that?
every 6 months, a whole body checkup must be done, especially individuals above the age of 30, 35. Uh, y- earlier cholesterol, diabetes, blood pressure, all of these issues used to start after the age of 40. Now it's starting from 20.
Great.
We
So
see,
unfortunate.
yeah, we see young chaps, having blood pressure as high as 160 by 110. So that's all lifestyle basically.
Yeah. So, what is the most frequent question you get asked by your clients, who do your program, and when you try to help them, what is the most frequently asked question that you get?
Yeah, so one question is, ma'am, in how many days will I be able to lose weight? Then I have to explain them, darling, it depends on your metabolism. It depends on how much your body has been abused. So, for some people, immediately they can see the results. For some, it takes some time. So, this is one question that I asked, like in the first session itself. And also, a lot of people were like, come to me and they are like, "Okay, can we get one session from you?" And I tell them, no, one session is not going to help you. So, I never give just one session. I never give just 1 month diet plan. I always, it's at least 3 months. Why? Because this is a habit forming process.
Mm.
Things that you've been doing since years, you can't change it within 1 month. Otherwise, you'll relapse.
Yeah, it's years
So,
of conditioning. And like you said, how much has the body been abused? That's a great point that people don't realize they've been abusing their
yeah,
bodies. And,
yeah.
they expect the body to just recover and come back to whatever they want in
Within a month, yeah.
days. Yeah, days, let alone. Yeah, 3 months is the minimum. Even for my sessions, my clients, I'm like 3 months. Like if you want to go to the root of any issue and deal and heal with it, at least 3 to 6 months. So I agree with that, 100%.
Absolutely, absolutely. One more question I would like to, because this is very important for the listeners. Uh, Ma'am, can we get a detox diet?
Mm,
Well, I really want to be very open here. There's nothing called as a detox diet.
okay.
Your liver and your kidneys are very much capable of detoxifying your body. You don't need to have an extra Karela juice or a Lauki ka juice to detoxify your body. Okay, all you need to do is give your body the right kind of substrates, not just for one day, every single day. You have to choose every single day. You have to win every single day. So then your body, if your body is getting everything that it needs to heal itself, now you are a somatic coach, so you know that body is an amazing machine.
It has
It can,
everything.
it
Yeah,
has everything, yeah. So it can heal itself beautifully. All you need to do is give it the right substrates.
that's so beautiful. Instead of symptomatically trying to fix something, doing something from the surface, when we address the root, then the body heals itself and it is having all the resources it needs. So that's a
Yes,
beautiful.
yes, yes.
What do you think is India's biggest nutrition issue, like that most people suffer with?
Oh, India is ranking one in terms of it is the diabetic capital of the world. Recently, it is the fatty liver, non-alcoholic fatty liver capital of the world. And you will find at least one person around you who has either of these issues, either blood pressure, diabetes, young girls having PCOS, high cholesterol, high uric acid, all of these things. So Um, and all of these things are lifestyle disorders, meaning they can be managed, prevented, and reversed with lifestyle. So that is the major issue that India is having right now. We are, the number of non-communicable diseases is rapidly increasing. So we need to address that. When I was in my master's and I had participated in a beauty pageant where I won. So they had
Wow, I
asked
didn't know
me the
that.
same. Okay, so they had asked me this question: what is your goal? What is your vision? So I said my vision is to. I am a patriot, of course. My vision is to um like take off the title of the diabetes capital of the world from India. That's it. I mean, I
I'm
really
sure
don't
you're
want,
gonna, yeah.
yeah, I don't want my country to have that title.
And you're saying these things can be reversed, managed and reversed, because a lot of people, yes, are struggling with PCOS. So, do you want to talk a little bit more about that?
Yes, yes, absolutely. So, just because I'm saying that it can be managed through diet doesn't mean you don't need medical attention. Okay.
Mm,
If your blood sugar levels are very high, if your blood pressure is very high, and if you think that, oh, I am just going on a diet from today and it will be all fixed, that's the most foolish thing you'll do. Because you need to, it again, it's a collaborative effort, the medical team and the nutrition team. So initially, if it's very high, you have to take medications to bring it down. Otherwise, it will start damaging your organs. It could be heart, it could be
most
the
people are
kidney.
scared of side effects of taking medicines, but the side
Right.
effects of not taking medicines are
Yeah,
sometimes higher.
absolutely. That is bang on. Yeah, that is bang
Yeah,
on. Yes.
especially if it's
Yes.
very severe case, because I'm saying this as a somatic coach, all about, not needing interventions. But I have clients, I tell them, see a psychiatrist if necessary. Like, you need medications at some point, especially when it's extreme, and not everything can be fixed by fasts or, like detox diets, right? The right
Yeah,
intervention is necessary. And
right.
sometimes there's so much stigma around it to take
Yes,
medications, because
yes.
people are like, no, there are side effects, I'm scared of it. But you're already having side effects by not taking medicines when you need to.
And look at the quality of life you're living by not taking the medications.
Right,
So,
right.
I would like to share a similar incident. So, I have a client who is also my friend.
Mm-hmm.
So, he consulted me for his diet. His blood pressure was high and corporate person. So, very stressful job. So, his blood pressure used to be above like 160 and 110, which is like very high for a
Very high.
28-year-old. So, he is a 28-year-old guy. Uh, One major contributor to his high blood pressure was smoking 60 cigarettes a day. 60
Oh,
cigarettes. Okay. Now, the thing is that, of course, diet can help you to, potassium, like nutrients like potassium, magnesium can help you to heal your body, to, the inflammation which the cigarettes are causing, it can kind of lower it down. But the root is the smoking. If you don't stop the smoking,
right. And why is he smoking? What is he coping with? That is connected to, again, maybe possibly a mental health disorder, right?
yeah, it's yes, as I told you, he's into corporate.
Too much
The
stress,
stress, yeah. So what
right?
I did was I was like, "Hey, now you need to really." So his diet and everything came into place, but he was not able to leave the cigarettes. So I referred him to a psychiatrist. In today's date, he's not even having one cigarette.
Wow, the power of getting the right kind of help and timely help.
Yes, and this
Wow.
is
And look how much
Bhagya, I'll
people are
tell you.
suffering, right? Like, this is mind-blowing.
So,
Wow.
and Bhagya, I'll tell you one thing that this is one another problem in India that people don't refer. They don't refer.
Mm.
Okay. So if there is so if a pediatric case comes to me, very small, 1 or 2 years kid, I refer them to my pediatric fellow dietitians. Okay. So this system is not there. So you can't handle everything alone, and you need to acknowledge that
But do you
your
think people do
expertise.
that? People do that just because they want to have more clients or patients.
And that's what I'm telling you now. They want everything. They
But
don't
it's so
understand
harmful for
the
the patients, and it's so insensitive and inconsiderate.
yes, yes. So I knew nutrition is not going to help me remove his habit of smoking cigarettes. So a psychiatrist was needed there, and it was done, and so you see the results now.
But then you actually
So
care for the patient beyond just your practice, right? Like that
of
integrity
course, you have to.
is necessary in all practitioners. It's so important.
Because it was hindering the overall result, right? Like, if I am giving him the best diet, I'm asking him to work out, I'm asking him to sleep well, but he's not able to sleep well because his nervous system is so hyperactive
Right,
because of the cigarettes
right.
and the nicotine. So
Stress.
he
Yeah.
so you have to treat the root cause. So that's why uh that was the best decision, and the best part was that he listened to me. He
Oh,
listened to
that's
me.
important. You can tell
Yeah.
someone what they need, but if they're not ready
Yeah.
to make that shift, that again, that is an individual's responsibility. They cannot just expect to do nothing and expect life to change.
Absolutely,
Yeah,
absolutely. That's why
it's teamwork.
in detail, in deep counseling is very important. Making the client or the patient understand what is the root cause of this is very, very important. So,
So it's
yeah,
important for people to seek practitioners who are aware of the holistic aspect of healing, not just,
yeah,
okay, now you're my patient, I'm going to give you medicines and that's it. But I actually
yeah.
genuinely want you to heal, and I will refer you to people I think will be able to help you. Yeah, that is so necessary. And it's so sweet that, you have that quality of, I know you're a very kind person, and we need more doctors and healers and dietitians and
Yeah,
nutritionists or whatever,
absolutely.
like
Yeah.
that, have
Yeah,
who
yeah, yeah, yeah.
stop thinking about just themselves, and ultimately that's going to benefit them because they will get better testimonials and referrals, if they have a positive
Absolutely.
experience.
Absolutely. Absolutely.
So beautiful. So what is, you said you're a patriot and you want to make India, you don't want India to have that label of being a diabetic country, right? So what is your vision going forward to create a larger impact through your work?
So, definitely, as I told you, I don't want that title, my country to bear that title. So, spreading awareness as much as I can. I'm working on the visibility so that I can again spread awareness. Your platform is doing that. So, thanks for having me, Bhagya. I'm sure this will help a lot of people, and it. I feel that it should also, like, on a what can I say? Nutrition is a subject which is not there in the syllabus. So
Mm-hmm.
basic nutrition knowledge should be there in the syllabus. There should be, schools should keep organizing nutrition sessions. Colleges should do that. Corporates, so they do. I know that because I have gone and delivered a speech to a lot of a lot of companies. So yeah,
Right.
but this has to happen more frequently, more frequently.
Yeah. If you had to give all our listeners something to take away from this session, or just, what would you like to tell them? What would you want them to have as a takeaway?
As a takeaway, definitely one thing is that people need to understand that they are hesitant for spending 50,000 for something, investing 50,000 for something which is going to prevent so many complications. But they are okay to give 5 lakhs if they have a heart attack or if they have any major issues or any complications. So prevention is better than cure is something that we have been learning since childhood, but nobody is thinking of it,
Practicing that.
practicing it. So this
Yeah.
is number one takeaway. My second takeaway is definitely please don't fall for any crash diets. And third takeaway is that work on yourself. Try to understand, try to listen to your body. Even if you're like if you're feeling tired, if you're not able to cope up with the work, there's something that your body is trying to tell you. So address
Mhm.
it.
Wow. These are brilliant takeaways. Thank you. Thank you so much for sharing.
Yes.
It was a beautiful session, even for me as a reminder, right? Like to do blood work every 6 months and make sure that we address the root of the issues. And I'm sure for all the listeners too, it's a great reminder to not just go behind like these trends that's happening, but
Yeah, yeah,
actually get yourself the help that you require rather than trying to look cool or just try some fancy fast or diets that's happening.
right.
So thank you so much, Priyanka. Thank you for your
Most
time.
welcome.
Yeah.
I would like to add on one more thing. testing yourself, and as I said, under underdiagnosis is happening. Testing yourself is all the more important now, even if you're in your 20s, is because right now we are living in an obesogenic environment. Meaning, if you step down, from your society, or you just walk from your home, you will see so many fast food joints. So the accessibility of fast
Mm-hmm.
food has increased so much, and you will see hardly somebody selling fruits, or or any healthy stuff, basically. So and also, guys, it's very important to know how to read a nutrition label. We will have a different session on that. But there are so many brands who claim
Yes.
to be
Yes.
healthy, but then there are so many hidden, mysterious names, hidden names, which the common population cannot understand. So, these are few things that I
We'll do
want
this
people to
part
be.
two. We'll explore this
Yeah,
in depth.
yeah. So I want people to be mindful of the environment that they are living in, and also don't, especially if you have children at your home, don't stock up your groceries with lots of biscuits and bakery items. And whenever you're hungry, you should always have access to healthy food. If you don't have access to unhealthy food, how are you going to eat it? So I think that
Right.
environmental shift is very important.
Yes. Yes.
So
Very
that's
true. Very
that's
true.
one more takeaway I would like to give.
You know, when we met in Goa and you gave me those dry fruits, I came back and I ordered dry fruits. I usually don't, so that's already positive influence. Now I have that for snacking.
Awesome, awesome. Great, great.
Okay, let's
So,
have a rapid fire round. I'm gonna
oh,
shoot
there's a rapid
random
fire.
questions. Yes.
Oh my God. Okay,
I know you're
let's do
unprepared
it.
for this, but yeah, let's just see.
Let's go. Let's go.
Let's go. What's your favorite time of the day?
It's early morning, 5 a.m.
Okay, why?
I feel more aligned with myself. I don't know. I have a different kind of energy at 5 a.m. I can do a lot of things in the morning because, there's a sense of calmness at that time. It's Brahma, almost close to
Yes.
Brahma Muhurat, yeah. So I think most of my work gets done at that time. So that's why.
Okay. What's the best compliment you've received?
Mm.
I
That
know
you
you get a lot
influence
of
people.
compliments.
I know, I was choosing which one to say. But yeah, but as far as my nutrition practice is concerned, that I am told that I'm very empathetic.
Aw. What song can you listen to on repeat?
Oh, wait, I was listening to that one yesterday. I think it's बादल पे पाँव है या छूटा गाँव है, that one.
Nice, nice. If you could switch lives with one person for a day, who would it be?
Sushmita Sen.
Aww. Yes. What secret about the universe would you want to learn?
Sorry, I didn't get that.
What secret about the universe would you want to learn?
Uh, I mean, how to channelize your energies? Probably that,
Nice.
yeah. I
That's
mean,
very deep.
so yeah. I mean, yeah, manifestation, everybody knows about manifestation in today's time, but how does the universe channelize it? I would like to know.
No, I
Yeah.
think that's a very profound answer. Lovely. Yeah, that's
Okay.
the end of the rapid fire. Thank you so
Oh,
much.
okay.
Yeah, we'll definitely have more podcast, explore the nutrition labels and all. As you said, we'll have part two, part three, as many as you
There's a lot to
can
talk
share.
about gut
Yeah.
health. There's a
Gut health,
lot to
brain gut health, the second brain, all of
brain
that.
gut axis, your gut and skin axis. There's a lot. There's a lot. I could keep going.
Yes, we'll connect. We'll keep it short and sweet. Thank you so much.
Yes.
To all the listeners, thank you for tuning in. I'll be sharing the Instagram links of Priyanka and mine in the description so you can check out our pages and follow for more content. So please subscribe for more podcasts like this, and I'll see you guys for the next one. Do like, comment, subscribe. Now I can say that I have my own YouTube channel. Thank you so much. All
Great.
right.
See you.
Bye.
Bye. Bye.